Thank you for the opportunity to come to you today and talk a little bit about COVID and where we are. Over the last 9 months, there's no doubt that COVID-19 has a dominating influence on the events of the city, the state, the nation, and really the world. COVID-19 has posed a significant impact on both our health and our prosperity. Despite these impacts, the city has worked to manage a response that secures both a healthy Pensacola, but also a prosperous Pensacola. It is likely that in the last 9 months, regardless of which side you find yourself, you have disagreed with the city, but really more likely my decisions in how we've responded. That's okay, because much of our reaction to COVID-19 in public discourse is centered on politics and principle. However, the city and my response is based on neither politics or principle, but on people. I would never choose between a safe or a prosperous city. Why would we allow ourselves to be limited to such a poor choice? My response has been very focused on achieving a safe and prosperous city. This all confusion and the need for this came from the confusion when I saw WEAR said I was looking at lockdowns. When we had 246 hospitalizations in July, we did not have a lockdown. At the Monday press conference, I was asked if I'd rule out lockdowns. These speculative questions do nothing to protect or advance our community. And based on the current condition, I do not believe lockdowns are necessary. But I should have given a better answer than what I said. I simply said no, because we don't know what local conditions will be. And if local conditions became 5,000 hospitalizations, we may have to consider something different. What we've said since April is that we have to advocate for local decisions based on local conditions. We need to continue to do what we've looked at dealing with hospitalizations. We've indicated that is the key factor that has influenced our decisions. It acknowledges when people go in and when people get better and they recover. It has allowed a way for us to show the whole idea of what we've done is dealing with people and keeping our hospitals open. So we continue to use that as our primary example. We have worked to keep businesses opening and operating. However, when we have had spikes, we haven't closed businesses. Instead, we've asked you to mask, and you did. And we saw what happened during the summer, and it was successful. However, and this brought the numbers down. However, I am very sorry that in September we were unable to rescind the mask mandate. And again, everything I said in September has come true now in where we find ourselves in November. I said our numbers are going to go up, and we're going to find ourselves where we're unable to do anything to bring forward something that provides it. And worse yet, we're going to have created eroded confidence in what we were doing with our mask. I get that. I understand we're fully under mask fatigue. I understand when I talk to Steve Richards and he tells me that in the months of July and August, when we went to go talk with businesses, we had zero compliance issues. Everyone complied. But today we are having more and more harder and difficult times dealing with businesses fully instituting the mask ordinance. Again, I think we should have been very clear, as I said before, in being able to do that. But we find ourselves now where we've gone forward. When we reach 75 hospitalizations, which we did, we have asked you at this point, we need to mask up. Now we've been able to keep our mask, our hospitalizations have slowly increased, but they've been a very slow increase. This has been nothing like what we saw in July necessarily, but I think some of that is because of you. Those of you who are wearing your mask and what we're doing, we certainly appreciate that. And we would ask everyone to think about wearing their mask because it keeps all of us at this particular time when we find our hospitalizations going up. But if we come down to a point where we can get hospitalizations down, we are absolutely looking at ways we can relax and be able to come forward. We understand all of you are challenged and tired of dealing with this. No one's more tired of dealing with this than I am. That's why I wanted to be very clear about what we were saying, because I think there was a lot of confusion over the last couple of weeks. We believe that masks absolutely do help us. but mask mandates under themselves do not necessarily create the results we want. We understand that we should only be asking you for a mask mandate when we believe there is a condition that warrants that. And that's what we've tried to do with where we find ourselves right now with the hospitalizations increasing. However, if we all work together to create what we need to do, we can reverse the trend. We've done it twice. We did it first in April, and we did it second in July and August. If we get serious about this, we can reduce our trend. The most important thing for us to do is where we continue to create both a safe Pensacola and a prosperous Pensacola. We have not closed our businesses, and yet we found ourselves being able to deal with a significant spike in the summer and a significant spike now coming back in the fall. We ask you to work with us, and we will only ask you to take these certain actions if we get to a certain point. But we need to all be working about this together. And what we need to remember is, regardless of where our politics or our principles may be, those are not the most important decisions we make as a community. We should be thinking about the people of our community and how we can choose to have not a safe or prosperous Pensacola, but rather how we make decisions that allow us to have a safe and prosperous Pensacola. At this particular time, the city of Pensacola in Northwest Florida, I feel very good at. The current experience we've seen over the last 9 months, we are not at a point ever where we had hospitalizations and our hospitals overrun. What we had instead is we had certain increases, but they were manageable for our system. We never had to shut down other businesses, and we were allowed to keep people open. We realized that asking you to wear a mask is inconvenient, and we certainly wish there was a better way for us to work through this. But at this particular time, we would ask that you wear your mask and deal with the inconvenience so that we don't have to do something else that changes. I don't want to get to a point where we have 5,000 hospitalizations, that we become a New York City or an El Paso or some other community that is overrun by the virus, that becomes both an unsafe community and in turn an unprosperous community. That would be the worst thing for us to have. So again, while we can work together, it is important that you work with us. And the most important thing that we want to do is stress that we want to keep businesses open in ways that people can keep their jobs. And we believe all of this is accomplishable if we do the right thing. We were able to have restaurants open in May, in October, in September, and not have impacts. There are many cases where we've been able to do this. So it's not a case of what our principle or our politics are. It's simply a case of, are we willing to work together to create both? And I realize there's a sensation to say we're looking at one thing or the other, to pit state and local together. I've been very complimentary of the way our governor has handled, for the most part, COVID. I do believe he has allowed, for the most part, local governments to make decisions that are best for them. I do feel like some of the decisions that prevented us from being most effective with when we go with masks have created challenges. But at the end of the day, I would advise him that to allow local governments to make the right decision based on their local conditions and what we're experiencing. And to also be able to show forward to him that we can find ways to manage this. And when we're in a difficult situation, that we apply certain things, but if we bring down, that we take and rescind those off. I think this is very critical, and I wish we had done differently. I've certainly wished and argued back in September. It was a very challenging discussion as we had it. In fact, I know I had many people here in city management who disagreed with me, and I realize all of the council disagreed with me. But at the end of the day, I understand my decisions were never about politics or principle. They were always about people. And I understand people probably in listening to people on social media who've said it very easily and honestly when they've said it. A lady said, I take a mask with me and I wear it when I feel I need to. And I think it said all that was there. If we feel threatened, we will wear a mask. If we don't feel threatened, we won't. You can't mandate these things. You can only have people in compliance with you if you earnestly work at what's going on with the threat. So as we move forward, we are trying to put forward something that will be both a safe Pensacola and a prosperous Pensacola. And I think from that end, I want to be very clear about how we're responding to things and what's going on. I think now is a time when we should have a mask mandate that allows us to get there. But if we get down below hospitalizations, if we get them back down to 50, we should take that off. I think what we've said very clearly is we're looking at events that have been very culturally important to us, like Mardi Gras, and that if we are in a very high hospitalization area, there's no way we can have that. But every one of us ought to be able to come together, wear our mask, and do the right things so that we could drive down hospitalizations and be able to do those things. These aren't choices that we have to choose one or the other. We can have both. But for us to do both, it means we've got to be more and we've got to be receptive to some things. The only reason we ask you to do this is because it helps us drive the numbers down. If we didn't have to ask you to do this, we shouldn't be doing that. We sit on the precipice of perhaps having a vaccine that gets us past this. Like I said before, nobody wants this 9 months to be over more than me. But at this particular time where we sit, we really need to work together and not against each other. I think that's the most critical part of where we are at Northwest Florida, is that we're not El Paso, we're not New York, we're not Los Angeles, we're not a lot of these places. We're not even in our own state, we're not Miami and Fort Lauderdale and other places. We're Pensacola. Our position should be based on Pensacola and what we're experiencing in Pensacola, and we should be working together to create that. And that's what we're trying to do in what we're communicating. And if we get to a point where I ask for an emergency and we ask that you wear a mask and we ask that you're a business to do so, we need your compliance in working with us. We were very successful in what we did in July and August, and we can be successful here. But I fully understand, and I will work more diligently with the council so I think they understand now everything I tried to say in September, which I don't think was as clear to people in September that they knew where we were going in November. But we find ourselves right here where I communicated where we said we were, and I realize those are the challenges. But the only way we can build trust and consistency is by working together. So if we could do that and bring our numbers down, that's what allows us to keep doing forward. At no time have we said that we're going to do lockdowns or do anything else that's going to threaten what you and your livelihood are doing, especially if we can be responsible enough to keep our hospitalizations down, which we've done throughout this. So at this particular time, just to be clear, that is not what we're looking to do, but at the same time, we're not going to rule anything out because it is unproductive to speculate on what local conditions are. But again, our decisions, our ideas, and what we're doing are not motivated by politics or principle. They're simply motivated by people. You, the people of Pensacola, is who we're trying to take care of. We want to be safe and prosperous, not choosing between either one of them. So I hope I've been more clear, and I apologize that I wasn't on Monday, but I'm happy to answer any questions. And I know there's been a lot of confusion based on some of the things that happened in the Monday press conference. And I appreciate the opportunity to at least be able to explain where we are.
We just have one question right now from Tom Neinstein at WWF. Are there pockets in the city or county where more cases crop up?
The contact tracing we've had from DOH has really not allowed us to see as much on that. We don't know. We obviously have zip codes, but even zip codes don't mean a lot. I think the one thing that we know that is common is probably the more density you have, the more likely that it is to have COVID. But we've clearly seen COVID come into places that are even less dense. So it's not that anywhere's immune, but on average, it tends to be as you're finding more density. But at this particular time, what we've tried to focus on is more who ends up in the hospital and what we can do to head that off. I guess from the last press conference, I did meet with all the hospitals. They confirmed that even though we're seeing positivity rates and new cases go up, we have not seen hospitalizations take the same trek they did in July. I think at this point, we still need to be watchful. We need to be wearing our mask. This is a time where we need to wear masks and be serious about bringing down the impacts of what we're doing. But at the end of the day, we may have a vaccine around the corner. I certainly hope we do. But I think we have to plan for a future that doesn't necessarily have that at this particular time until we know what we can do. And I've said back in July, I've said in September, I've said several times, this is going to ebb and flow. We need to be prepared for the ebbs and the flows. And if it's increasing, we need to take actions that will bring down. And I promise you, we will work very hard to be consistent in what we do, because I understand mass fatigue. I understand what it's like. I understand what it's like when I talk to Steve Richards and he tells me the stories of talking to people out there, and I realize the challenges we're having. But that's why I only wanted to ask for a mandate if we actually needed a mandate. And I think that's the only thing we should be doing, and we're going to work hard to communicate that point better to council. But I think we clearly hear that people are mask fatigued. But this is not a time for us to stop doing what we're doing. It's to be diligent, bring the numbers down, and then we can work within that.
And this is a follow-up question from Tom. He said, for instance, if someone is treated at West Florida, will that become part of the rate for Ferry Pass, or is it their home address?
No, it would be their home address. You're not limited to which hospital you go to. And remember, this is all hospitals within the 2-county area. So you also do have Gulf Breeze and Santa Rosa Medical that are a part of this reporting.
And sorry about the delay there. When I was switching cameras, I think I got a lag. I actually don't see any more questions. We'll post this link on our city YouTube and on the mayor's Facebook, but Mayor, if you have any closing comments, we don't have any other questions from the media.
No, I certainly hope this clarifies a little bit about where we are. You know, I want to be very clear that we've realized the importance of working within our businesses. It's not only enough for us to have a safe Pensacola. We've got to continue to worry about our prosperity, and we're doing that. But we can't have a prosperous city that sacrifices our safety either. So we need to have both. And that's why it just means we sometimes have to take measures and deal with inconveniences that get us through. But our whole goal is to work in that way. And when I really look at where we've been, where we are relative to the nation, both in terms of COVID safety and within economic prosperity, we have positioned Northwest Florida in an extremely good position, even despite hurricanes and everything else we've been after this year. I know it's been trying, but we're going to get through that, and I certainly appreciate your patience in working. You got one more?
Yeah, there is a bit of a delay, so we do have a couple more questions that came in. First one from Randy at Channel 3. He said, we consistently hear that many students and school officials are not wearing masks. What is your message to these folks?
You know, again, I think, Randy, we've tried to be very diligent that right now, when numbers are up, we got to be serious about masks. They do help us bring the numbers down. I do wish when we had been realistic about getting numbers down that we had been more serious about understanding what mask fatigue could do. And so, but now is one of those times that we absolutely is what we're expecting and what we need to do. And again, this is going to ebb and flow. So we don't manage the schools, but if we have programming in our community centers, and we require masking and everything and anything that we do. So we're very consistent about the need, you know, in the programming that we have. So again, outside of exercise, we expect you to wear a mask. If you're in a sporting activity, we understand you're not going to have a mask at that particular time. But every other programming that we have, you come into any of our buildings, you do anything else, you wear a mask. So that's what we work. We've been able to have, I mean, when you look at restaurants and a variety of other things, we've had things open and we've been able to do things without seeing increases. So again, I don't know exactly how this thing transmits, but it certainly tells me there are cases where we see we're able to exercise and do other things without mask and be successful. But clearly there are moments where we're avoiding that congestive area where we get into congestion and in close contact, and that's simply a time that you've got to wear a mask. And I think it's important in retail and other places that we wear masks for the courtesy of those around us. And again, that's been the practice we've certainly tried to do here at City Hall.
And this is also from Randy at Channel 3. He said this is off topic, but can you comment on FDOT nixing the ferry, and do you anticipate getting together with Gulf Breeze to do a ferry?
Randy, I would tell you that the whole thing about the ferry system is it had to be based on paying who was going to pay for it. Gulf Breeze and the city don't have the fund. The city of Pensacola don't have the funds. I mean, we were able to put forward our landing project. The city of Gulf Breeze couldn't even place their. Of course, theirs was considerably higher than ours, but neither of us were going to be able to do operating expenses on that. I will say the city of Pensacola is very likely in the near future will have a second docking facility open. If other private individuals simply want to use it, all we ask is that you work with us to sign a waiver. Otherwise, we don't mind anybody using our facilities to take people back and forth if people wanted to engage in that. We're trying to, I guess, encourage as much water taxi, water usage as can be. You know, I was disappointed to hear it, but I certainly understood DOT's position. It shouldn't have come out of DOT, and it wasn't my expectation that DOT should pay for this. It was my expectation that Skanska would pay for this, and I would have thought they would have at least in some gesture to our community, the expense of what they put us through would have come forward and stepped forward with the money. But obviously when they didn't, I understood why the Secretary of DOT and even if they legally should have, by the time we argued it in court, we'd already have the bridge back open. So I understand the decisions they made. I was hopeful when it started we would have something in there. The city, as I said, has invested in docking facilities to have people have that opportunity. If people want to do it, we have places available. However, for us to take on the expense of the ferry was simply going to be beyond our capacity to do so.
This is from Jim at P&J. If Mardi Gras is allowed to go forward, what steps will the city take to keep it from becoming a super spreader event?
Jim, again, as I said before yesterday when I talked with people from P&J, I mean, right now we are very much in speculation because we don't know what the case numbers actually are. It's still January 5th was determined a date. It's almost still a month and a half, 2 months away. Where we will be at that particular time. We had time and we wanted to look at it, but we were very open on two different fronts. We weren't going to do something if we were in a bad condition, but at the same time, if we were experiencing in a good position, we didn't want to deny people something culturally that has worked here, has been a part of this community for almost 140 years. So from that standpoint, we continue to work on it, and we're going to look where the hospitalizations are at that point. I do think you will see, no matter if everything was perfect and we had the ability to do it, there would be certain provisions that we're talking about. We're talking about making sure that perhaps there's going to be limited numbers on floats. There will be we'll be requiring masks to be worn by those participating in the parade, and we are even looking at probably non-traditional parade routes that give us more open spaces rather than congestion. I think no matter what happens with COVID, the one thing we've seen is the more congested we have it, the more risky it is. And I realize there are a number of things that happen, and perhaps we look at it in a number of ways. I mean, even New Orleans said we may not do parades, but we're going to do something with Mardi Gras. So I think one way or another, we're going to work very diligently to honor our cultural heritage and roots in a festival that's been very important to our community. But we're not going to let it happen in a way if we can't protect and make it safe. But I think at this point, the one thing we all discussed is on November 19th, it's way too early to call. And that decision needs more time and a better understanding of what our conditions are at that time. I would say, you know, it's interesting. We found ourselves today with as many people as we had in the hospital last Wednesday. So despite kind of a short run up from the week before, we've really kind of leveled out. But part of that is hopefully we just got to keep taking it seriously. And I get it. I mean, people say I wear my mask when I feel the threat. I guess we're trying to make sure that people understand is now is one of those times that is important and the threat is greater. When the threat is not as great, we understand and we're going to try to work through that. I mean, mass fatigue is a real thing and we're seeing it. And like I said before, we're not getting as good a compliance as we had before. So we're trying to work through that.
This is from Randy at Channel 3. Do you have any concerns about Pensacola going forward? There are a lot of indoor venues, unlike Mardi Gras, where the balls are inside events. Do you fear it could cause a spike if Pensacola goes on as usual?
Randy, I mean, there's some Mardi Gras events that are planned that are shrinking numbers. We may have to look at that. I mean, but again, that's at the end of February. Who knows what may happen? I mean, I'm praying that this vaccine works and can get out there and start getting distributed. So who knows what the numbers will be? I mean, you know, again, it seems like more and more people. You know, one of the good things about we've had more and more people get it. I mean, there's more and more. Maybe, you know, we might have more immunity out there than we've had before. So we're trying to deal with the science and learn as we go along. I mean, one of the best things that I heard from the hospitals when we talked the other day is one of the things they talked about was that even in both April and in July, they saw a significant number of older patients that were obviously the more challenging and more acute in the severity of COVID. However, they have not been seeing that at this particular time with the run up this fall. So again, I mean, it's too early to say that it's not going to happen, but you know, I think it's really too early for us to make a decision for February based on the conditions in November. Local conditions as we get closer to local time is what we have to make things. And so I think speculating and making decisions for events that are 3-4 months down the road is really impossible for us to make today.
This is from Jim at the News Journal. Has the city had to issue any code enforcement citations for the mask ordinance, or has it just remained verbal at this point? We are we are at this point evaluating with Susan Wolf. We have had discussions on what we can do in moving forward in doing that. So I mean, you know, if there are places that have absolutely been you know, clearly defined in their position, I think we will be looking to take some actions against those places. You know, I think the bigger part is when you talk to code enforcement and they tell you, boy, in the months of July, August, and September, we rarely went into anywhere and didn't have automatic compliance and people supporting us and working with us in the businesses. Not having the same experience this time around, I think that's clearly a factor of what I spoke to in September when I asked for this to be rescinded, and I think we probably should have been more cognizant of that. But again, until you go through something, it's hard to figure that out. But you know, again, my feeling is if mandates worked, we would just mandate everything and we wouldn't have to do anything. I mean, I think what shows is mandates work for a short amount of time. If you can focus them on actual achievable results in its short time, you can win with it. But you can't keep a mandate when there is no threat because eventually it loses out.
And again, I'm as sorry as anyone that I was unsuccessful in September in convincing council to do that. And again, I was probably I'm looking at some of our upper management people, and I know they were all against me at the same time, against that decision. But I stand by it so much because I knew this was going to happen. I knew we were going to get to a point where we were going to be dealing with this, and a point where we had rising increasing, and it would erode confidence in masks. And again, you live and learn. But I think mandates are good in short spurts where we can show what we do, and once we achieve, we've got to move off of it and then bring it back if something comes back. Because right now, we're having challenges getting confidence back within the public to do what we need to do.
All right, we don't have any new questions.
Well, thank you very much. I appreciate it.